In a recent video, I talked about the use of ketamine in depression treatment, and especially with treatment-resistant depression. This great comment asks, do you think we could isolate the specific chemical further for increased accessibility? And I'd say the answer is probably no. And here's why. Ketamine, it's already a fairly simple molecule. It's not like cannabis where you have all of these psychoactive substances together and we're trying to figure out which one's doing what. With ketamine, we are trying to figure out what it's doing, but I don't know that there's much more to isolate. Now, what we might see is as we better understand how ketamine helps with depression specifically, that we develop new related drugs that are better for depression. And I suspect that will happen, that there'll be some ketamine derivative over time. And there's another piece here that's important, which is the holistic experience, that taking the substance and having the therapy seems to be the most effective. Doing just therapy, no. Doing just the medication without the therapy, also not as good. And in addition, that part of that experience might be the dissociative effect. And so sometimes, and we've seen this with other substances, when you figure out a way to remove the dissociation piece, you also remove some of its efficacy. I would say for accessibility, what we're more likely to see is increased understanding of that dynamic and having more and more treatment centers appear where people can get that treatment covered by insurance, with time off from work and so on. That would be my hope. And I'm happy to talk more about how the treatment works if you want. Just comment below, and I appreciate the conversation.